Which of the following is most likely cause of her acute renal failure? All right, so renal question here. 45-year-old woman is admitted to the hospital with rapidly progressive glomerulonephritis. Her creatinine is increased from 1.2 to 4 over the past week. She has hypertension, currently taking an ACE inhibitor. Urinalysis reveals hematuria, proteinuria, and red blood cell casts. Okay. Um, 45-year-old woman. She has hypertension. Um, I just don't know if they get RPGN with, like, right off the bat, I'm thinking, okay, fibromuscular dysplasia, just because of the demographic and the hypertension, which makes me think like renal artery stenosis. However, is it one-sided? No. I don't know if that gives RPGN. If that's just intrinsic. I mean, she does have hypertension, acute renal failure. I don't know, but isn't that usually one-sided? And there could be like flank pain.
I think you're thinking through things correct. So
Okay. Yeah, I'm just between renal artery stenosis or one of these, but usually the rules for like pre and post and intra, they usually give like your BUN and your creatinine. I don't see that here, which I'm a little confused by. So it could be something simpler, and I'm just not, it's not coming to me. Let's see. Hematuria, proteinuria, red blood cell casts. Hematuria, proteinuria, red blood cell casts. Micro. She has hypertension. I don't know if I could go away from renal artery stenosis just based on the
good.
demographic.
Okay.
Yeah, I
Final answer.
wouldn't. Yeah, I'd go for that, even though I'm not super confident with it.
Okay. So I
Yeah.
would actually pick exactly what you have picked because of the ACE inhibitor, but let's figure out
Okay.
kind of what they're saying here.
Okay.
Rapidly progressive glomerulonephritis, increased hematuria, all consistent with intrinsic renal, which is caused by damage to this percolating gland. Well, this is actually actually looking back, it's just we misread it because if you talk about rapidly progressing glomerulonephritis, that's a glomeruli issue, which is by definition intrinsic. Does that make
Okay.
sense?
Yeah, that
Yeah.
makes
So,
sense. It was
um,
I was between this. I was like probably overthinking that she has hypertension and
sure. No, I mean, I was
demographic.
thinking the exact same thing you were, right? Like
Okay.
an ACE inhibitor will cause kind of that renal artery. That's I think stenosis is actually not the right word either. Renal artery would be constriction is a better because
Okay.
stenosis says that there's something like blockage, right? But
Okay.
ACE inhibitor, you get what I'm trying to say? There's a slight
Yes.
difference
It's
there.
not stenotic. Like it's not getting blocked here. We're not.
Yeah,
Okay.
it's constricted for sure from the ACE inhibitors, but not
Would another thing be because it's bilateral? Like, do you not get renal artery stenosis bilaterally either?
I
Or is that not
mean,
really a
yeah,
real?
I wouldn't think about bilateral versus unilateral here.
Okay.
Um, so for instance, like renal vein thrombosis, she has no risk factor for clotting and you'll get a lot of pain. So that's out of the question, right? Pre-renal, they don't say that she's bleeding a lot or she's dehydrated. So unlikely. Post-renal, she doesn't have any kind of suggestion of like a kidney stone, which is super
Okay.
painful, or a mass, right? Like a kidney, a kidney cancer or anything like that. So actually, best answer is going to be intrinsic here because it is they give you rapidly progressing glomerulonephritis, which is automatically is an intrinsic thing inside the kidney with the glomeruli. So
Okay.
it has to be the answer here.
Okay.